Aho, kitipilo hele, yesipi yayani, lasawanwa.
Hello, and welcome to Among the Shawnee, a podcast for Absentee Shawnee tribal members. I'm your host, Mindy Longhorn, Media Director for the Absentee Shawnee Tribe. Hello, everyone. Today we are talking about something that impacts not just Indian country, but pretty much everyone. That's diabetes and wellness. And with us today, we've got SDPI Coordinator, Diabetes Wellness Director. Did I get that right?
That's close enough. Yes.
Joseph Holtzclaw and Mark Scott. That's an easy one. You are the lead fitness specialist at the Absentee Shawnee Tribal Health System. Welcome to the show.
Well, thank you for having us.
Thank you.
So since we're talking diabetes and wellness, let's start with, what does SDPI mean? That's part of your title? What is that?
Yes, it's a special diabetes program for Indians, and that's one of the grants that help fund our department.
Okay.
And we have two grants that we fund our department, Good Health and Wellness and SDPI.
Okay, so what do you guys actually do in this grant?
Many things. So first and foremost, we see patients, one-on-one consults with patients in the clinic. And then another big part is our community presence. So Mark and I and our team of Christy and Zane, we do many functions in the community.
Outreach events?
Outreach events, correct.
I know you were at the zombie run recently.
Yes.
You do lots of physical activity challenges.
Yep. We do. We just had Diabetes Day today, so that's an event where we invite 5 participants to come to our clinic, and they can basically get all their different departments in.
Like their appointments?
Appointments in one day, in one morning. So saves them from having to make multiple trips to the clinic. So we just take care of everything in one day, from optometry to dental to primary care to fitness.
They need,
everything they need in one morning. And then we also provide them with a nice pair of fitted running shoes for participating in it too.
Wow,
So
can't beat that.
yeah,
That's nice. Okay, so how often do you have Diabetes Day?
We've been doing it every other month. So that's just one of the many little things we do throughout the months and everything. So
with your grant.
Yep.
And I know you do the fitness. You're an actual trainer, right?
Yes. So Zane and I are the trainers there, and we're located at the resource center.
And you're there and that's a free resource. I don't think a lot of people realize that you're there and you're free. It's free.
Yeah, we get that a lot. So we don't know that you're here.
You're here, exactly.
Yeah.
So that's at the resource center. And what are the hours if someone doesn't know?
So Monday to Tuesday, it's from 7:30 to 6, and Wednesday through Friday, it's 7:30 to 7.
Okay, and they can walk in?
Yeah, they can walk in. They can call or email as well. We have the link to sign up for the gym on the Tribal Health website on our page. We also have flyers around
I've seen a QR code.
Yeah, so that'll take you to the same place. Or if you just come in, we also have the QR code. Or if you don't use a computer very well, I'll pull up mine and we can sign you up there. Yeah.
And then they can set up like sessions one-on-one with you.
Yes.
Or someone else.
And I experience the same thing all the time when I'm visiting with patients and bring up the resource center and trainings, that they're not aware that we have that available to them.
And it's not new.
No, it's not new at all.
It's been there for a while.
Since, I think, 2002.
I think you're right. It's been a while.
Yeah.
And it's free.
And it's free. So
it's
that's
a free
the biggest
resource,
part.
Right.
Yep.
And the training part is free. Because if you were to go to a gym, personal trainers are expensive.
Yeah, they're probably about $1 a minute.
Wow.
So
okay. That's another free resource.
Yep.
Yeah, and we also see a lot of people that live too far from the gym to actually use the gym very often. But with those people, we'll do an initial session and see where their health and fitness history are, what their goals are, do some fitness assessments, and then write a plan they can follow using whatever equipment they have available, either at their house or at another gym. And we try to make it match their whatever they like to do. And because
no one wants to work out.
I know exactly.
Right.
But if they like to, play basketball, or they, hanging out with
right.
family is really important. And so, do you go to the park? Is there, somewhere you could go and do things together? And so, because if they enjoy it, they'll probably do it more.
Right. I mean, it's not fun to work out. But no, so you try to make it to where they can actually incorporate it. Or if you had a dog, take your dog for a walk, something like that.
Exactly.
And then they can always, have training sessions with you guys, right?
Yeah, and I just try to be available. Like if they want to call or email, I can update their plan periodically. And if they have any issues or they're even bored with their current plan, we can update it. And there's multiple ways to be healthy and improve your fitness.
And it's free. I mean, like you said, not very many
That's
people.
the best part of it.
That's free.
Yes.
It can't be
With
free.
the economy now and everything going on, I mean, it's such a bonus.
Right. So you might as well take advantage of it.
Yep.
And the training.
Definitely.
That's also
And they,
free.
come in there 1 or 2 times and they can prescribe home workout regimens and things like that. So they don't have to come up there continuously, so they can do that. And they do chair exercises for people just variety
you
of
can
things.
do at your house, right?
Yep.
And that's all free. We like free. And I know another thing you do the classes, right? You do nutritional classes, cooking classes.
Yeah, we do cooking classes. Right now we're doing them for the elder community here at AST, once in the Resource Center where Mark works, and then down here in Title VI building or the multipurpose building. So we're doing that. We're trying to really increase those. We're partnering with public health, and they're assisting us in doing those continuously. So, and we're looking to grow that more often, do more maybe do videos and things like that too. So we got a lot of big plans as far as cooking classes and demos and stuff like that. So
Do a podcast on cooking classes.
Yeah,
I mean, we could. But okay, so you're helping out with nutritional aspects too,
Yep.
as well as just the fitness.
Yeah, this last month was bison pot pie, and it was very good.
yes.
Wow.
So took the recipe card home, and
That's
we're like,
good.
we got to make this a year.
And it's cold, so that's good.
Yeah, definitely.
Okay. And you guys are both where your office is. You're at Resource Center in Little X, right?
Yes.
Yep.
And that's where you are as
I'm
well.
at the clinic.
Oh, you're at the
Little
clinic
X
in
clinic,
Little
yeah.
X. Okay. But if they want to come work out, that's where they can find you.
Definitely.
And I know something else that you said you guys do, the in-body scan. That's also free. So
That is.
what is that?
So that's basically a scan that we provide at Little X, and we have one down here in Shawnee as well. So it's basically gives you a full body analysis. Like when you typically step on a scale, you see the one number, but you don't know whether it's muscle mass, fat, water weight, many things like that, where this in-body scan shows you all those. So if you're looking to lose weight or something like that, that you can track, am I losing muscle? Am I losing fat? Maintaining muscles, our goal, losing body fat, and then visceral fat as well and stuff like that. So, it just gives you the full body analysis compared to just a scale shows you one number,
Right. And that's another free resource.
Correct. And no appointment needed for that. You can
you
come
can
to
walk
Diabetes
in
and
for that?
Wellness and just ring the bell and ask to do a body scan.
And how long does that take if someone wanted that done?
5 minutes or so.
Oh,
Yeah.
okay. So you literally just step on a scale and all the information is there.
Correct.
And that's free as well.
Yep.
See, I didn't even know you had that.
Yes.
Probably a lot of people.
Come on down, Mindy.
No,
Yes.
I don't. We don't want to do my scan.
Yep.
But I don't think a lot of people are aware that you have that.
And that's why we just recently, Mark and Zane made our departmental flyer with all this information on there, QR codes to make it easy sign up. And we're trying to get that just out everywhere we can to make it, more people aware of what's
That's
provided
why I found
there.
it, right?
So,
Because I didn't know that either. I hadn't
Yep.
seen it. So now you're going to be overwhelmed with people wanting to get scanned.
hey, that's
They're all
that's
going to
fine.
come in
Tell them to
and
come
get
in.
scanned.
That's
and
fine.
then they're going to want to go work out. After that, they're going to want to see you
Yep.
probably.
Of
So,
course. Yeah.
Yeah. I mean, once they see those numbers, then they're going to want to come see you. So it's just your whole body wellness then.
Yes.
Nutrition, fitness, all that stuff that we've been taught. That's what you're here for.
That is
And you
right.
do a lot of outreach events as well, right? And partnerships.
Yeah. Mark, you want to talk about some of our partnerships?
Yeah, for the zombie run that we just held, I mean, it's one of our largest events and seems to be well received. Everybody likes
Everyone
that event.
likes that.
Yeah. So that's been a goal of ours to try to partner with more people so we can kind of offer more things than we even have staff for. So we partnered with the Kickapoo tribe, and they had a lot of experience doing videos, and so they came out and did a promo video for us.
that.
Yeah,
Very
man,
nice.
they had 3 cameras and wireless mics and a drone.
Same.
And
Yeah, it was
It was
pretty
legit.
amazing. Yeah.
Yeah.
Right, I saw the video. It was
real
good.
professional. And so, and then we went out for their Elders Olympics and got to help out with that and see a little bit more about what an event like that could be. And so then they came out and helped with our zombie run. You might have seen them at the finish line taking some pictures as well. And so, and we, hope to hold one of an Elders of Olympics of ourselves like later in next year. So
And we're already talking with the Seminole tribe. They host them, so maybe they'll do a summer one, we'll do a winter one, and we'll
Keep
send
them active.
kind of help each other out by sending participants to each, and and we figured like Mark said, like the more people we partner with, the more we can reach, and then have help assistance with our events and like grow ours and grow the number of events and everything. With, like I said, such a small staff that we have in diabetes and wellness, but we
Right.
can impact
More
people.
people. Right.
Yeah.
Keep
And to-
everyone healthy.
to learn from each other too, like
What they're doing.
Yeah, we talked with the Odo, Missouri tribe because they've also had like similar events, and so their director also came out to our event and she was able to help out. But we just kind of got some new ideas and how we could spice it up and
Make it better.
Yeah, that was really
Yep.
good. And we had people from our Southern Plains Tribal Health Board came out, so everybody was really helpful.
So hopefully next year it'll be even bigger and better.
Yeah, I think we had the biggest zombie run yet this time.
Wow.
This number of participants and everything.
And next year it probably will be bigger than that.
We're hopeful. Yes.
If
That's
it wasn't for
exciting.
the rain, I mean, it
Oh,
was kind
yeah,
of
the weather.
touch and go all day. We were in communication, like, okay, having our emergency plan set up if the lightning
Can't
came
control
or
the
something.
weather.
So, yeah.
You do, that's one
That's
of
the
the
thing in
things.
Oklahoma.
That's
You never
right.
know.
You just don't know what's going to happen.
Yeah, so props to everybody that, braved the weather and came out.
Came out. They're the ones that really want to get healthy and stay
Yeah,
healthy.
they
then,
did.
If you're out doing that. But I think the tribe did have Senior Olympics. It's been a while, but I think they've had it before. So you're bringing it back then.
Yeah, definitely.
I think they've had those. It's been a while. So that's hopefully next year, maybe.
Yep.
Some plans coming up in the works.
Yeah, well, so starting in March, we're going to start some elders fitness classes. We're going to hold them at the Resource Center. The plan right now is to do like Tuesday, Wednesday, Thursday at 10:30. So that way when we finish, Title VI Meals for Elders will be starting
Okay.
about at 11 so they can get a meal before they leave. And we'll do like a 6-week series. So the plan right now is to start with chair yoga. Then we'll do maybe an aerobics, chair aerobics, and then maybe a strength class, something like that. And then at the end of the year, we'll kind of culminate with this Elders Olympics.
So we're building into it, type of thing.
Yeah.
So,
Okay. Get them ready for it. And that's,
we've done chair volleyball many times, which they love. So
I've seen the photos. It's like they
those
had a
are
good
fun.
time.
Those
Right.
are fun. Yeah, and they're competitive too.
Oh,
so
yeah.
Yeah.
a lot of them don't want to do it at first, but then when they get in there, they're spiking and
They come
screaming,
alive,
and
yeah.
Wow.
I have
okay.
to
lot of
tell them
fun.
to tone it down because the ball is more horizontal than it.
Oh,
There's no
yeah,
lobbing.
yeah.
Yeah, it's
So-
just spikes.
That's coming up. That's exciting. Hopefully they'll probably have a lot of people come out for that. So that's for the Title VI participants as well. I mean, you would have to be
Really, I mean, anyone
Anyone
but
that's
it's
an
just
elder?
an elders fitness class. Yeah.
okay. And they could stay and eat if they wanted to. I mean, why not, right?
Yeah.
yep.
And then maybe you might do some cooking classes too.
And we that's what we've been doing with them, cooking classes and rotating. Another partnering with public health, where like they would come out and do a little demonstration of some sort. What did they do with They had like leather making or something here. I mean, they always have some type of other thing, and Mark will do either, he'll do a fitness class or we'll do a cooking demonstration. Kind of rotate that with them. So
Yeah, they
kind
did
of keep it new and interesting.
They did a painting
Painting
class one
okay.
time. Yeah.
They just do different
okay.
stuff like that.
That
Different
was for the
activities.
Yeah.
Elders Fund Days. So it's with
Okay.
our partnering with the Public Health
Public help
Department.
on
Yeah.
that.
Yep.
Okay. So you're all about partnerships.
Yes, definitely.
Always.
And I think you mentioned something when we were talking before. Was it Cleveland County or Pot County? You've got some stuff in the works with them too.
Yep, that is currently in the works. It's
Okay,
another
that's
like
exciting.
like nutrition type lifestyle change program, where we currently do a Wellness Warriors, which is our diabetes prevention program. Like it's a year-long program. Well, this Way to the Wells, like an 8-week course. So it's kind of a shortened version of it, but it really focuses on many aspects of nutrition, fitness, lifestyles, behaviors, many things like that. So that's another little thing we have in the works right now. So hoping to
Stay tuned for that.
yes.
You guys are busy.
Yeah,
Very
there's always
busy.
something to do.
I know. There's
And-
all these people
and-
that you've got to keep healthy.
And like the partnership thing, it's not just other tribes. It's
Agencies.
It's in our tribe too. I mean, like with dementia program to public health to just anyone and everywhere. I mean, we've already partnered with and we've helped many other little events around town. They always reach out to us because we'd love to do that, and we'll help out any way we can. So, and then once again, if we're kind of needing assistance in ours, we just reach out right to them for assistance,
Right. So it goes back.
Yeah, like something like our zombie run. Oh, if we didn't have the great partners that we had, there's no way that,
do that.
a department of 4 people could put on an event like that.
If you could do that, whoa,
we're very blessed.
Yeah, it would take a village. It's a lot to do that, I'm
Yeah.
sure. So kudos to you. And hopefully next year it looks exciting.
Yeah,
coming up.
definitely.
Now, I know the new Shawnee Clinic is supposed to open next year as well. You guys are going to have a facility there, possibly, I think,
yes, we will.
coming soon.
Nice new office and everything, and then the gym is
Workout
going to
center.
be beautiful and bigger than any we have yet, I believe. So
Wow, okay. And so you're going to have more staff, I would assume.
that is the hopes,
Okay.
and that is in the works as well.
So they'll be able to do personal training out there as well.
yes.
All of the same things.
And it's going to be quite a larger area inside, so maybe fitness classes inside the gym as well. So where right now none of our gyms are that size,
right.
So
We're all cramped for space here.
That's
so
correct.
That's right. But the new facility,
yeah,
bigger and better, and that's where you're going to have. That's next year.
yep.
Well,
Well,
2026.
whenever it's
coming.
finished, I mean,
Hopefully next year.
yes,
Hopefully. And another thing that I wanted to hit on, GLP-1s. We can't mention diabetes without saying that, I think, because it's so popular now. I guess everyone's taking them, not just people that have diabetes, but they're prescribing them for weight loss too.
yes.
I mean, I feel like we kind of have to mention that, maybe.
Do we have to? or-
Well, I feel like it's
No, I'm just kidding.
it's very prevalent. I
Yes.
think we all know people that are on them.
Yeah. And to me, it's just an aid to get to, down the point of just some assistance to lose that weight.
Like a
So-
tool, right?
Yes. And right now, we have a program at the clinic where you come, you get with your physician, and you can start that. But then the criteria is you're going to meet with nutrition, you're going to meet with fitness, you're going to meet with behavioral health. So we encompass everything, not just like here's some meds going your way. No, we're trying to help,
Get to the root of the problem.
True,
I mean, really,
yes.
so to speak.
And everyone I meet with the first time, I'm like, this is just a temporary thing, So in the meantime, while we're taking this and possibly losing the weight, we're learning new lifestyles, new habits, and things to get to a point where down the road, if you're taking off these meds, you're good. You can maintain that weight loss. You can continue, with these fitness goals that we've set, nutrition goals we've set, lifestyle changes and stuff like that. So,
Right.
really working on the overall picture than just, here's some weight loss.
Take these meds
yeah.
and see you later, and
Yeah.
then lose the weight, and then when you stop, it comes back.
Yeah.
Usually it comes back, plus more.
And that's another time we're using the body scan machine to make sure, if they're losing weight, they're losing body fat, not muscle mass or anything like that. So,
So you're doing it the right way,
yeah.
not the
I believe
easy
so.
way out. I mean, that sounds like
Yeah.
not the easy way out. I don't think it's easy at all to lose weight at all, but
Yeah.
I just feel like it's very popular now.
That it is.
I mean, it's everyone. It feels like everybody. We know people that are on it that do not have diabetes, so that's why I felt like we should mention it.
Yeah.
And that's something that you have. And what was that program called? Wellness?
Oh.
Wellness
Why
Warriors?
you gotta now you
Why
got
did
me
I ask? Wellness Warriors? Warriors Wellness?
spread that flyer. Dang it.
That's okay.
Okay.
Something with wellness and
Yes.
warriors?
My
Okay.
goodness.
Okay, I shouldn't have asked, right?
You
I
shouldn't have asked,
I
Mindy.
shouldn't have asked. But there is a program. So
There
if they
is.
call, they'll probably want to start with primary care first.
Correct.
If they call and they're interested.
Yes.
That way they can get on track. And that program, did you say it's like a year?
No, I mean that one's just however long the physician,
Okay.
works with them. The year-long programs are diabetes prevention program.
Oh, okay.
But that one is just, the doctor, decides
It may be
how
6
long.
months, right?
Yeah.
It may not be a
3
year.
months, 6 months, a
Right,
year.
however
so.
long they feel that you need to be on that
Yeah.
medication.
And then same thing when we're comfortable with where they're at, maybe we can kind of lengthen out the visits or something like that. Once we feel they're comfortable with a routine of fitness or nutrition or everything. So
But they have to come in and weigh. Like you'd have to help be accountable, right?
yeah,
Every month, probably.
Just depends on the person, but like every month to 2 months, we like to do a body scan to track, make sure, catch if they're losing muscle, we catch it early type of thing.
Or they're not doing anything at all.
Yeah.
If they're not losing, then you're going to
We need to
find
make
out
some
why.
more changes. Yeah,
Right.
exactly.
Probably have to up your workout, huh?
So this is all greatly increased referrals for both our departments. I'll tell you that.
So you're busy.
It's a good thing. So
Yeah. So we're just I'm getting you more referrals probably, so you can thank
Oh
me
yeah,
later.
thanks.
Mhm,
Thanks, Mindy.
Yeah, they're all going to
I'll
call
never
you
be able
now.
to leave in a day here.
No,
so.
you'll be like, never take lunch. Like, it's my fault. But I think that's good. The more people that you help try to get healthy, we all need help staying healthy.
Yep.
And that's what you're here for.
Yep.
And you do outreach, prevention, all of that. It's a whole.
And that's the thing is I like to relate to my people is like, I even struggle with nutrition and working out and being consistent. Like we all do. It's like there's rare people that are just focused on that and, perfect at working out, don't miss days and stuff like that.
Don't gain weight.
They're like, because
Right.
life these days, like stress comes and goes and some months are crazier than others, but it's how do we get through those times and stuff? And so I try to relate like how I do it. And like, I even fail a lot of times too, so we just got to get back up and get back going again,
But you've got him probably on cracking the whip, making you work out, right?
A little bit.
I mean,
And then
You talked me into the employee hit class today.
I actually did. He tried
really?
to get me
So-
out of it because he didn't want to be all sweaty for this interview. I was like, come on now. I was like,
so you had to work out today.
It's a team effort,
Yeah.
Okay, so that's really dedicated.
Yeah.
I just came from a party where we sat and ate Mexican food, so chips and queso.
I would have rather it if you would have invited us
No,
to that.
who's had the healthier day today? Let's
Hey,
see.
you didn't say to come early.
It's you guys right here. So.
Then we had primary care's little function yesterday with chips and queso and all that. So,
So-
see, we did ours yesterday.
Okay,
so-
yesterday I didn't eat much, so it's balance, right?
Yes.
It's all about balance.
There you go.
Yeah.
Cheeseburgers and a Diet Coke, right? Isn't that
Sure.
how that
Water.
works? Water.
Cancel each other out.
Okay. I mean, that doesn't work. No. Okay.
Yes.
No, we don't. You don't want my nutritional advice here. So, but no, we probably all need to do your workouts every day. Another thing I wanted to ask before we're done today: do you have any success stories? Someone that's done really well in the program, maybe that you feel like we should highlight.
Yeah, I think there's many. I mean, so many people are putting in hard work,
Right.
and I think consistency is such a huge win. But one that comes to mind is one of our participants in our Wellness Warriors year-long lifestyle change program. And because of their hard work and weight loss and physical activity, they're even able to come off of a blood pressure medication.
That's great.
Yeah. And, so many people, that's really a high value for them. They said, I don't want to be on as
take
many
these pills.
medications. And, when you need to be on them, they're really helpful and they're great. But if you can reduce the dosage or even come off of some, it's a huge win for them. So,
Oh, I can imagine.
And that is our goal. I mean, when I have patients on insulin, my goal is to help them get off the insulin, 100%.
That's
to,
a great goal.
Keep these changes we're working on growing until they can eventually get off those things. And that's a similar one I've had. I mean, I've had countless patients that are starting on insulin and we slowly making changes and they come back to see me every 2 to 3 months saying they've kept me in mind in our goals and they're just sticking with them and just so thankful. You can see it in their eyes. Those are the most rewarding out of them all when people tell you the impact you made and the changes we worked on and stuff like that. That's just, there's nothing better, than seeing that.
You're changing their lives.
Yeah.
I mean, really, for the better. And then did you have any more that we wanted to hit on?
yeah, I think the way that the clinic and our departments are set up is just so unique because as a personal trainer, I have a relationship with the doctors and we also have access to the medical record system. So I can make my notes in there. I can review patient notes from their doctor. And the referral system, when the doctor wants them to see personal training, then I get that right through the medical system and I can see any notes the doctor has for me. And so one of our referrals recently, they came in and there was just some abnormalities in their fitness testing that gave me some concern. And so I just sent a message to the doctor through the medical system, and he was able to send some urgent testing to be done. And I just thought that was just really cool because if we weren't able to have that communication, if I was just a trainer at a gym down the road and the doctor didn't know, I would just have to rely on that patient to, be able to explain to the doctor what happened, which is kind of confusing if he doesn't have that background. And, we just get the person taken care of. And I think it's overall better care, and it's more like comprehensive, because every specialty is kind of in a silo. But if we're able to communicate, then we can really treat the whole person and not just one aspect of it.
That's why they should come and see you.
And that's the beauty of our clinic. I mean, we cover so many areas altogether in the whole clinic, where these people normally would have to go out to many different places throughout town or on this side of town, that side of town, where our clinic encompasses most everything, it's just.
And then you can communicate, like you said, with.
Yeah. And we know all these providers, so we can pick up the phone, call them directly, send them messages directly,
like you
and get answers for them. Many times for my patients when they need something, instead of like, hey, you need to go and talk to your doctor, I can pick up the phone and, hey, I have your patient here. What can we do for him? And stuff like that. Where, you can't do that in the normal life and outside in the cities and other hospitals and stuff like that,
So it's prevention too.
Yep.
Yeah, prevention and management, because let's say like if a person came in for behavioral health and they had like moderate depression, well, exercise is as effective as medication for moderate depression. So, as a personal trainer, I want to have my hands involved in all aspects of, prevention and management for people. So if that person has a prescription for an antidepressant, but they're not exercising, then we're really not, attacking all aspects of the treatment. And so we want, whether that's diabetes, depression, heart disease, or, more rare conditions, like there's usually exercise can affect that as well. And so we want to have the best outcomes for our patients. And, they really can't do that if they're not also, looking into fitness and nutrition as well.
The whole package.
The whole package, yep.
And that's what you guys are doing.
Yeah. And we can, things that are outside of our scope, we can get them referred to see the people that they need.
Instead of, like you said, going to a regular gym, you're not going to get that. And I know a lot of times it's scary when you walk into a gym, it's intimidating. And so they're seeing you guys one-on-one, you're getting their history. And
that's another good thing about having like Mark and Zane, they come from like heart hospital backgrounds. So they're more clinical type of background compared to like a lot of maybe fitness specialists, trainers and whatnot.
At a regular gym.
They really do the whole, once again, totally, look at the whole person's like chart and like just kind of really all about them, before they just get them on the treadmill or whatever like that. Mark's checking vitals and labs and everything like that to make sure they're safe to exercise. Safety is a big thing,
And all of this is free. Like I keep
your favorite word.
I know it's free. I just feel like it's underutilized. That's probably the word. The resource center, the in-body scan. Did not know that was even available. So hopefully people will learn that that's available too as well, and that might help people.
Definitely.
Yep.
The more, and I'm just giving you more work, really.
That's good.
That's fine. Yes.
Welcome. Mm-hmm. So, and we can't have a podcast. I feel like I like statistics. So, and we know that your work is so important here in Indian, really everywhere. Native Americans are 50% more likely to be obese than non-natives. So I feel like the work that you guys do is super important.
Well, thank you.
Because of that factor. And that's not even that they're 3 times more likely to develop diabetes. So got a double whammy right there. So I think it's very important, the work that you're doing.
Yep.
Anything else we didn't hit on? Anything coming up you guys want to talk about?
Yeah, I think I'd like to talk a little bit more about our Wellness Warriors program.
Is that the one that we were talking
So I think they both have wellness in the name, and that's a little confusing.
This is our diabetes prevention program.
Yeah.
Okay, so what is that?
So it's a CDC program, and it's a year-long lifestyle change program. And so the initial study that came out for it showed that people who participated in the program and met the 2 goals, which was to lose 7% of their body weight and to do 150 minutes of exercise a week, they reduced their chance of getting diabetes by 58%.
Wow, that's a good statistic.
Yeah. Now, which was interesting is one of the diabetic medications, metformin, only reduced it by 31%. So it's almost twice as effective as just medication alone. Now, our program here, since we had staffing and everything set for it, we opened it up to more than people who just qualify for the diabetes prevention. So anybody that's interested in lifestyle change, they want to get more active.
Yeah, we're not going to refuse anyone.
Yeah.
Where before it kind of had criteria, and I'm like, you just can't refuse anyone. If they want to participate, we might not be able to focus on, count the numbers, but we'll still have people that would, we'll have participants that do qualify that we can count their numbers. But so it's just, we kind of opened it up a little more to more people in our participant or, at our clinics and everything. So
that want to get healthy.
Yep.
And we offer it in person and virtually.
Oh,
so
okay.
we start off meeting about once a week for the first half of the program, and then we move it to every few weeks. So there's like less frequency because we're teaching you all these new lifestyle things and then giving you more time to implement them on your own, maybe struggle a little bit, go through a holiday season, and then come back and go, oh man, okay, I really succeeded here, and we can all celebrate as a group. And then here's what I had trouble with, and we can kind of like brainstorm and come up with new solutions. And the group aspect really helps with that because, so many people are so creative in the strategies that they've tried or new recipes, and we can really just support each other through the group. And the program's a year long because, Christmas is once a year. And so, there's like things that just happen in a year that I think just don't happen in a shorter program. And we cover so many things that like anything that affects physical activity or nutrition. And there's a lot of aspects that are not necessarily difficult, or complicated to understand, but there's just so many things that you don't think about. Like, let's say like visual cues or social cues on physical activity and nutrition. So like, okay, if my wife buys cookies or whatever, I wasn't thinking about cookies, but then there's cookies on the table when I walk home, and now I'm just thinking about cookies. So you're like, well, maybe I could ask her, could you put those in the cabinet? And then that way I only eat a cookie if I really want a cookie, and not just because I saw it. I know now.
Thanks.
There you go, Mindy.
No.
This is an example of a social cue.
Right.
Yeah. So maybe
Right.
don't talk about cookies
Yeah,
around me,
let's not.
Yeah, exactly.
Broccoli.
But yeah, there's like lots of little things like that
Little
affect
tricks.
how, what we're eating and how we're being active. So like Joseph asking me to go to the HIIT class today, that was a good social cue on, and we're able to have that in our department where it's like a more on the healthy help,
But the beauty of that Wellness Warriors class is like the camaraderie that evolves from it. Like these people start together, and then once again, the lifestyle coach is just there to kind of cue the conversation, give the topic, and then we kind of get it going around with the other individuals, helping each other. Like, hey, I've experienced that before. Here's what I did, and that's kind of the beauty of it. You really start developing friendships, and and people that have been in it the first year round, like they're ready to sign up again for the second year. And
they
stuff.
can do that,
And
right?
yeah.
It can be a repeat.
Yeah.
So it's more of a, like you said, and you can celebrate each other's victories.
Yes,
And you're
100%.
not on your own. So do you have to be a patient at the clinic to be in this program?
I
think we've had outside people.
Yeah, I think we have had
Okay.
outside. And once again, I'm to the point where I'm not refusing people. If they want to
get
participate,
healthy,
we'll
and
get them in there.
You're all about it,
Yeah.
which is good. I mean, we all need to be healthy, and I want cookies now. Thanks a lot.
Hey, Mindy.
I know. I'm
Well, I want
hungry.
queso. You mentioned queso earlier,
Sorry.
so that's
I know.
that's my favorite.
I'm just going to start talking about working out, and maybe by the end we can get a little workout
Talk
going
about
before
broccoli.
we
I
finish
know.
Broccoli,
today.
broccoli.
kale, cauliflower.
Yeah.
Okay, now that I'm hungry, if anyone wants more information about any of the programs or they want to contact you, it's all on the website, asthealth.org. Can't believe I spaced out on that. Your emails are on there. There's phone numbers, your flyer,
Yep.
all of that stuff, QR code. Everything is on the health website. They can call you, come and see you,
Definitely.
come work out, schedule a workout.
You've got it.
Yes.
I mean,
Wow.
that's
Yeah.
what we want, right? I'm trying to
Yep.
get drum
And
up
that's
some
the
more
one thing,
business for you.
marketing. That's what we've really tried to grow here over the last 3 to 4 months. Getting our name, everything out there everywhere. I mean,
Do a podcast.
we bug you continuously
That's
about
fine.
putting our flyers
do.
out and stuff like that. And then the same thing with the health communications. Just everything we do, we're putting out our information because we want to make sure we hit everyone we can.
We all need to be healthier. So
Yeah.
And we're working on a wellness app right now.
I'm excited
So
for
that's
that
nothing
to come
that's
out.
kind of growing as well. But we're going to maybe start hosting like monthly fitness challenges and different other lifestyle like challenges. So
So if someone didn't live here, that would be good for people that lived out of area.
yeah.
And you've got an
Or they
app,
couldn't come to the clinic as
Right.
often or want to participate in some
or
type
not
of
want
thing.
to drive
Like,
here.
Yeah.
And we've all got smartphones, the majority of us. So
Yeah.
then you can download the app and join in. So now I don't
That's
have an
our-
excuse not to, right? Like,
That's right.
download the app.
the well-being app. Yep.
Yeah, starting in January, right? I think it's
That's what we're working on,
walking
getting it started in
challenge, Yeah, the
Okay.
first month.
That's exciting.
Yeah.
Another app. So there would be no excuse, right?
Well, people could still probably come up with
That's
something,
right.
you know.
Oh, trust me, I'm sure I could probably give you a good one. But I really thank you guys for all the hard work that you do, the diligent, keeping not just you guys accountable, everyone. I feel like diabetes and just poor health, obesity, we're all, it's such a big factor of the way our lifestyle is now.
Well, I mean, if you
It's
think
just the
about
way
it,
it is. That's
food
our
is
food.
everywhere. It's when we want to be comforted. It's when we're sad, when we're
eat.
happy, we want to celebrate. Just you name it, it's everywhere.
We get together,
you know?
we want to eat. We
Yes.
just came from that.
Yep.
So I think it's important, the work that you do, and hopefully you're building healthier generations to come.
Yes.
So thank you guys for being here on the show, and come back and we'll have another podcast.
Okay, we'll bring cookies next time.
Please don't. Thank you guys.
Yeah, thanks for having us.
Thank you for listening. I'm Mindy Longhorn. We hope you join us next time as we talk Among the Shawnee.
Nyawe, ye si hakaweta wiani. Salanoki ke no le poa.